when the heart's contracting. And then now I'm going to show you when the heart's relaxing. This valve will now be closed and this valve will now be open as the heart fills and prepares to pump blood again. So there's the mitral valve. We can see that's opening normally, so no restriction or narrowing of that valve. We can look at that from the top and the bottom. Again, aortic valve here. This is the inside of the aorta, so this is that major 30-millimeter vessel that comes out of the heart, and that's what it looks like on the inside. That little dimple right here is actually the origin of the right coronary artery that we looked at before. So that's the origin of that vessel as it comes off the aorta. And again, there's the left ventricle and the inside of that left ventricle here. We also can go back to the heart. We can take all those blood vessels we were looking at before, the coronary arteries, and we can actually strip those out. And now what we're looking at is just the coronary tree, as we call it. So there's all the blood vessels of the heart. And here's that plaque we were looking at before. We can look on the inside. This is the inside of that plaque.
It's like a hydra from biology.
Yep. And there's the outside. And note, this stuff is growing in the outside, fortunately for him, because that's how plaque grows.
Wow.
This is a long time. This is, hopefully, I think we got it just in time, but had that plaque begun to grow any further into the blood vessel, that's when he could have had a heart attack.
And if it broke open right here and a blood clot formed, that's just all she wrote.
Right. You're going to lose all of this. See how much part of that heart, that blood vessel there supplies. That's a big heart attack, and could even be a fatal heart attack. So we do the coronary tree, yada yada, and that's what it looks like, and we can spin it around. We're going to now, lastly, we can actually take all this information, all this three-dimensional information, put it all back, because before we just pulled the heart out, now we can add everything back. So here what we're looking at is the entire scan. So there's the breastbone here.
Yep.
There's the ribs. There's the heart. We're actually looking through the left lung. I can actually put the lungs back here, and there's your left lung, or I can take that out. There's the spleen here. There's the splenic artery going to the spleen. Here's the aorta coming up out of the heart, heading down to the belly. There's the heart seen from the right side. Again, I can put the right lungs back or remove them. There's the liver right here, stomach. These vessels right here, I always like to point out, that run right behind the breastbone. There's two of them right here and right here. Those are the ones we use for bypass surgery. And as I tell my patients, of course, we're out to make sure they never need them, but if you ever did need bypass surgery, it's good to know they're standing by ready, waiting there for you. We can look at your pectoralis muscles. There's your pecs right there. There's your pulmonary artery heading off to the lungs here. And we can also take a look at the trachea. There's your windpipe. So we can actually take a peek right down your windpipe here. So there's your windpipe or your trachea. And when we used to do this invasively, we called this a bronchoscopy to look for tumors and cancers and masses there. Now we can do it all virtually. So this is a virtual bronchoscopy, which we throw in there. And that looks good. No tumors, masses, cancers, no pennies, nickels, batteries, bubble gum. All that looks good. And then lastly, and I call this is now we've entered into the realm of stupid CT tricks. What I'm going to do now is there's the whole scan and the lungs, liver, spleen, all of that. There you are from the bottom. Stomach here, liver. There's the spine, spinal cord, aorta, the top. Now what I'm going to do for fun is I'm going to put his shirt back on. So there's his shirt right there.
There's the buttons right there.
There you go.
All
so
right.
that's it, Scott.
Voila.
It's the virtual autopsy.
Well, so when you tell somebody that your scan is normal, you've gone through a lot of things for them, haven't you?
When it's normal, it is buck stops here, do not pass go, normal.
And if you have, so when a patient, the process for state-of-the-heart cardiology is a patient comes in, they usually take some pills the night before to get their heart, make sure their heart's going nice and slow. They come in, they get the IV, they walk in, lay down, hold this, boom, 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 come back out, and then you'll either take the time to look at this
just
and
like we did today, we do exactly the same thing. We're going to sit down with the patient right then and go through the data right now, right here, because we can actually explore them three-dimensionally with this information. And as I tell you, half of this is useful information for me. Do you have aneurysms, pulmonary embolism, things that you probably couldn't even say or spell? And information for me to guide what's going on, what the problem is, and what we need to do to take care of it. But frankly, the other half of this tool is an amazing communication tool, where I could tell you about aneurysms, pulmonary embolisms, coronary artery disease, plaque, and you go, what is this, what's it mean? But when you actually are able to point it out, and I can say, there's a baby plaque, there's atherosclerosis, what do you want to do with it? It's an incredible tool for both communication and motivation and compliance.
It worked on me. I had plaque, took my medicine, I don't have plaque. I'm still taking the medicine because I know if I stop, I'll go right back to where I was.
Right.
So why would I do that? That's nonsensical. Well, John, thank you. What a wonderful tour you've given us, and we sure appreciate the state-of-the-art cardiology tour of the body. And you have a website, correct? sothcardiology.com.
That's correct.
And people can go see and learn a little bit more about these things there.
Absolutely.
Thanks again.
All right. Thank you, Scott.